Hi, and welcome to Journey to Recovery. Today we're going to talk about understanding depression. A lot of people deal with depression. Not everybody who feels depressed has clinical depression, though. So we're going to talk about kind of what the differences are and some things that might be causing depression. When we talk about depression, the first thing that comes to mind is just not having any pleasure or any joy in anything. You're depressed. It's like, I got to get out of bed today, really. Nothing makes you happy. And this doesn't necessarily mean constantly 100% of the time. Every once in a while there will be a glimmer of sunlight. But the majority of time, over the course of 2 weeks or more, you don't have pleasure, you don't have motivation. Things that used to make you happy don't anymore. That's the first criteria. In order to qualify or be diagnosed with depression, you have to have that one. The rest of these you may or may not have. So let's talk about some of the other symptoms that are associated with depression. If you're not feeling pleasure, you're not feeling happy, there's something going on. Your body is saying, I give up, I can't do it anymore, something has got to change. The key is listening and figuring out what it is that's got to change. What was going on before you got depressed and what changed? And what can we do to change it so things get better? The other thing that we need to look at is some of your other symptoms. Difficulty concentrating, that's one. Most of us, when we're sick, when we're tired, when we're depressed, really have a hard time concentrating. Sometimes we can't even string two words together, and that's okay. It's important to understand that's your body taking whatever energy it can find somewhere, because it's, tapped out, whatever energy, and putting it into surviving. So we have to say, what's going on? Why am I having difficulty concentrating? The other thing is that you may just not be motivated to concentrate. All of us have things that we like to do and things that we not so much like to do. We can concentrate on those things we like to do. The other stuff, it's like, oh, please. It's like when I used to do calculus homework. I'd get like halfway through the first problem and I'd be looking at the walls and doing just about anything to concentrate. Okay, so go back to that person who's depressed. Nothing is making them happy. So everything feels like calculus homework. Why are you exhausted? Why is nothing making you happy? Okay, so difficulty concentrating. Unfortunately, when you have difficulty concentrating, guess what? It starts negatively impacting other areas of your life because your work product goes down. You don't have the energy to focus on other people and listen to all their drama, so you may start withdrawing. Difficulty sleeping. Some people sleep too much. When they're depressed, they want to pull the covers over their head and pretend that the world doesn't exist and just stay there. Other people can't sleep at all. They have difficulty sleeping, they're so depressed, but their body's just not letting them sleep. And there are some physiological reasons for this that you probably don't care about, so I'm not going to go into them. But understand that not sleeping or sleeping too much can be a sign of depression. Both of these, and believe it or not, sleeping too much can make you tired, contribute to exhaustion, which may contribute to difficulty concentrating and loss of pleasure. See how these things are related? Now moving down on the symptom list to changes in eating habits. Some people, when they're depressed, eat too much. They look for comfort foods. They look for anything to try to give them pleasure. The other thing that they may be doing is trying to eat to maybe get some energy so maybe they can get off the couch. Or they may just be bored and nothing else makes them happy, so they might as well eat. The other end of the spectrum is people who just can't eat. When they're so depressed, they don't have the energy to get off the couch to go make something to eat. They're just like, yeah, tuna sandwich sounds good, but that means walking all the way in there to make one. I'll do it later. Paying attention to this. As nutrition goes wonky and comfort foods usually aren't the healthiest, your body starts lacking the building blocks it needs to make the chemicals that are responsible for helping you feel happy. So you're creating this sort of self-perpetuating problem here. Looking at what you're eating, if your eating habits have changed, if your sleeping habits have changed, difficulty making decisions. Think about it. Just for a second, if you're having difficulty concentrating and you're exhausted, decisions mean effort, and you ain't got the energy right now. Feelings of hopelessness and helplessness. Nothing makes you happy. Everything you seem to be trying isn't working. Your normal life is kind of turned upside down on its nose because you're either sleeping too much or not enough, eating too much or not enough. You're in this stage of disorganization, for lack of a better word. Okay, well, yeah, that can make you start feeling a little bit hopeless and helpless because you're like, this is my body. I can't even figure out how to make myself happy, how to make myself sleep, how to make myself feel like I want to do something. And it can be very frustrating. So again, we go back to the beginning where I said most of us have periods of depression. Things happen, we can get depressed. It's whether the depression lasts for a long period of time, 2 weeks or more, and causes what you interpret, you the patient interpret, as clinically significant distress. Is it causing you enough problems to motivate you to call the doctor and actually go in for an appointment? Is it motivating you to do something? Because the pain's got to stop, or the lack of pleasure has got to stop. So clinically significant distress. Now, what do we do about depression? There's a variety of things. I mean, obviously, if you watch TV, you know there's a ton of antidepressants out there, but a pill doesn't do it all. If you have brain chemistry that's a little wonky, medication certainly can help. However, if your lifestyle is not supporting your body to make the chemicals it needs and take care of itself like it needs, if you're not sleeping enough, if you have a ton of stress in your life, if you have poor social relationships, no pill is going to make up for all that. It's not a magic bullet. All it does is kind of level the playing field, but it's up to you to figure out what it is that is kind of causing that depression, if it's not 100% physiological, and start addressing it. Maybe you've got some turmoil in your relationships. You hate your job. You're at your job 40 hours a week at least, plus getting ready to go, driving there, driving home, and decompressing after work. That's the majority of your waking time during the week. So if you hate your job, then that could be contributing to depression. If you feel stuck in your job, that contributes to feelings of hopelessness and helplessness. Hey, you see how it all kind of relates? If we listen to our bodies and say, what is my body trying to tell me? Then we can figure out what the next right thing is to do. Look at times when you were happy in the past. What was different? And how could you make that happen now? I mean, you are not going to be able to be an 8-year-old with no responsibilities and running on the playground. That's just not going to happen. However, you can enlist the support of significant others to help you so you're not doing everything all by yourself all the time. Interventions like that are things that you can start doing right away. The other thing that I always suggest to people who have their first episode of depression, or it seems to have come from out of nowhere, is to go to the doctor, have a physical done. There are certain things like hypothyroid that can contribute to feelings of depression. If your thyroid goes too low, you have a lot of those same symptoms. All it is a matter of boosting that baby up again. Excessive anxiety. Think about sitting in your car, in the driveway, in park, with your foot on the gas. Eventually, you're going to run out of gas or the engine block's going to overheat. And then your car is going to, for lack of a better term, be depressed. it's not going to have the energy or the ability to do anything until you fix the problem. So if you have concurrent anxiety that's causing you to feel exhausted and have symptoms of depression, that's normal. That's your body going, we got to do something about this stress here. I can't deal with it anymore. Depression comes, depression goes. Some people have depressive episodes frequently. Other people may only have one in their entire life. The key is to address it. Identify it, recognize that you don't have to live that way. Try to figure out what's causing it, and then start taking steps to address it. It doesn't have to be huge steps. One of the first things I suggest to patients, aside from getting a physical, is to set their body clock. Start getting up about the same time, making sure to get some sunlight, sit by an open window, something like that, so your body knows it's time to be awake. Go through a typical routine and go to bed about the same time each day. If you get your circadian rhythms kind of synced up, then your body will start secreting the neurotransmitters and hormones that you need in order to feel happy and to sleep well and to concentrate. I'm not saying that getting on a regular schedule is going to make your depression go away by any means, but it will help, and it'll be the first step towards getting things back in sync. If you have any questions, feel free to email us at dr.snipes@drisinn.com. That's Dr. Snipes at drisinn.com. And I will talk to you on the next episode of Journey to Recovery. Thank you.